This is Krista Michener. Welcome to this week's episode of Made to Be Whole, recorded live from San Antonio, Texas, in the 2024 ILADS conference. Stay tuned to hear more about the exciting updates, treatment, and testing that I've learned about this week. Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So I'm recording Saturday night. I've had 3 full days of lectures here at ILADS in San Antonio. A lot of exciting updates. A few takeaways, though, about the learning process when you're diving into your own health and healing. I came to my first conference 4 years ago, and I felt like a total idiot. It was like drinking from a fire hose. There were so many people using so many words and discussing concepts and science that I was just not familiar with. And it would have been really easy to say, this is over my head. I don't belong here. But you keep going back, you keep studying, and every year, not only does it get easier, it becomes enjoyable. And then also I went from being an outsider, year one, to having relationships that I've developed, people I get to see and say hi to and hug, and it becomes a rewarding experience. So whenever you're embarking on a journey of learning in any area of your life, but especially with your health, if you have a new diagnosis or symptoms you've developed or something you're navigating for a family member, you will be overwhelmed, but it will get easier. My husband always says to me when I'm overwhelmed, Krista, how do you eat an elephant? One bite at a time. So one bite at a time. There's a lot to learn, but you take a little bit in, you digest. And then you also need to evaluate, I think, with learning what's most applicable to you. I have come to learn that when I come to something like a conference where we have a lot of brilliant scientists and clinicians that have deep expertise in specific areas, I'm not going to come away with the level of understanding that they have. So, my personal theme for this conference is learn and discern. And what I mean by that, there's a lot to learn. And I decided when I got here, I just prayed that I would have help discerning the things that would be most relevant to my life, most helpful for my family, most helpful for my practice and my patients. So if you're listening to a 30-minute lecture and you feel like, "Brr, brr, 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 brr," can you come away with 1 or 2 concrete things that can change your understanding of something or of someone else, or that you can change? That's a win, because if you go to 8 lectures and you leave that day with 8 to 16 things that you didn't know before that you can change, that's a tremendous triumph, and you will build on that. So we'll divide the things I've learned about into some of the categories that we've covered the last few weeks in our Vector-Borne infection series. Why don't we start with testing and some updates in testing that's been developed? One of the more exciting things is that there is now a direct to consumer test for vector-borne infections called the AcuDart test. It uses the technology, and it's much, much more affordable. It still has a high level of sensitivity and specificity. So sensitivity means that there aren't false negatives. It's sensitive enough to pick up the positives that are really there. And specificity blah, 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 means that there aren't false positives, because we also don't want to diagnose someone who with an infection that they actually don't have. So it is highly sensitive and specific test. If you go to their website, which we'll put a link to on the show notes, you can read more about what it covers. It does check for Lyme disease. And then they have a Bartonella test, which is also good. Doesn't check for as many species, but it's still a good test. The Babesia one's the only one that I have a little bit of hesitancy with, not for accuracy, because I know that it's excellent science, but it only checks for Babesia microti and Duncani. And as we talked about, a lot of chronic infections are coming from other strains, but it does check both of those, and a lot of hospitals only check one. They also do have a tick-borne relapsing fever test. So we've got Lyme disease, two species of Babesia, a tick-borne relapsing fever test, and a Bartonella test. Um, it's a finger prick. So you go online. The website's AcuDartHealth.com. But you go online, you purchase your kit, you register it online. They send you everything you need to do a little finger and do a sample. And then you get your results within 3 to 5 days of them receiving it. So that's pretty fast turnaround. Um, are there people that I would say this isn't the best test for? Yeah, if you're someone who has an immune deficiency, if you have an autoimmune disorder, or you're really chronically ill with a lot of symptoms, I still think you're certainly welcome to do it, but you'll probably need some of the more expansive testing later. So you may just want to skip this step and jump to that big panel. But what's amazing about this is the fact that it's direct to consumer and it's FDA approved. And when I was listening to Dr. Shaw talk, she's a brilliant PhD scientist who is the president of IGenics and helped with developing this test. She said, what happened, they basically told them this could be approved for Lyme either via CDC standards or standards. Hygienic standards are higher, they're more sensitive. The CDC tier of testing, as we've discussed, misses some things. She said they got back together and talked, and she said, you know what? We're just going to go with basically the truth. We know what's the better test. We know what's the most accurate. So we're going to say, okay, we're going for approval for these hygienic standards, taking the risk that they were going to say, eh, not going to cut it. But she said the FDA finally had the courage to look past the CDC and the limitations of what they're recommending and approved it using the hygienic standard, which is a higher standard. So this is a really exciting step forward for people. Other limitations, it's not going to give you, like we said, the species. If it says positive for Bartonella, it's not going to tell you which Bartonella species. The other thing that it won't allow for that I can do as a clinician with the broader screen, sometimes we'll have patients who have those indeterminate results that we talked about. So an indeterminate result's not a negative, but it doesn't meet the lab threshold for a positive. But if it's not a negative, it's not a negative. And sometimes I'll have someone who has no clear positive, but a lot of indeterminate results telling me that there is some antibody activity there. Their body just may not have made enough antibodies because these little buggers are so good at evading the immune system. So you're not going to have that gray area that helps a provider sometimes make more nuanced clinical decisions. But there is a lot of power now in your hand as a consumer. Don't need a doctor's order, very high accuracy. So I think it's a great step forward for the world of the vector-borne infections. Of course, then the challenge is if you get a positive test and you didn't have a provider order it for you, what are you going to do next? There are a couple of places where you can go to try to find a clinician. So ILADS itself, ilads.org, there's a provider search. You can put in your zip code. Unfortunately, there are ILADS providers in all states. There are other places like Project Lyme that has a database of providers, but it's a fantastic first step and puts a lot of power back into your hands. The other thing, well, one of the many other things I really enjoyed about this conference is meeting people who have inspired me with their own journey as clinicians and scientists. I talked a lot about T-Lab and how much I rely on their testing and how much I respect Dr. Mosiani. who developed that test. I got to meet and talk to him. Dr. Horowitz has been a real pioneer. I got to talk to him and a little bit of a personal story. So I went to a conference in July that Dr. Horowitz was speaking at because I wanted some more training and insight into his Dapsone protocol, which is a pretty intensive 9-week protocol. There's 9 weeks of Dapsone, which is a leprosy drug. And the reason he uses it is because it's really good at attacking these biofilms, but he's had luck with some really difficult cases using that. And before I dipped my toes in that as a clinician, I really wanted to get some more one on one training. And so after meeting him, I started using the protocol with some of my patients. And I got to tell him about my son, number 2 son, who we used this on, and it's absolutely changed his life. It's been a miracle. He came to me about halfway through treatment, at which point most people are feeling pretty tired because it's pretty intensive, and he said, "Mom, I feel like something shifted in my brain." And he autism spectrum disorder, has been diagnosed with ADD, bipolar disorder, but basically a lot of neurological dysregulation, a lot of social and emotional delays. We've struggled, like a lot of parents in this situation, with just things like hygiene, self care, motivation, employment. Halfway through this protocol, after he felt this shift he described, he started getting up every morning and showering on his own. He started brushing his teeth. He applied for jobs. He's exercising more. Kind of a funny story. He would have people bring him to my office because it's only about a mile and a half from my house to visit me during the day because he'd get lonely. And he was visiting me before this. I don't remember exactly, but it hasn't been too long ago, and he wanted to go home, and I said, "Well, I'm gonna be a while, but you can walk home." And he said, "What do I look like? A peasant?" And I said, "Well, your little brother walks home." He goes, "Is he a peasant?" And so he found a ride home, but after he had this shift, he started walking to my office every day. He walks there every day to see me, gets his B12 shot every other day. He won't let me give him his B12 shot at home because, and I quote, "context matters." He says that it is not natural for someone in your own home to come after you with a needle, but he's willing to come to my office and have that done. But it was a real privilege to be able to see Dr. Horowitz again, tell him about my son's project. He gave me a hug and I hugged him and he thanked me for telling him. And it was just super rewarding because when you meet these people, these pioneers and trailblazers who have been through a lot, at a banquet I went to last night, they pointed out that at one point, every single member of their organization who practiced in the state of New York had been investigated by the medical board. There's been so much witch hunting, unfortunately, and misinformation, and I would like to assume that some of it was well-meaning. I hope so, but a lot of these people have been through a lot, and to rub shoulders with them, watch Bill Rawls and Marty Ross and Dr. Burrascano, just a lot of really fantastic people, was very rewarding, and I have a lot of reverence for their sacrifice. Sometimes I hear people trash different people's treatment approaches, and we all stand on the shoulders of people who went before us. You know, it was just in the 90s. This is actually the 25th anniversary of ILADS. It was just 1999 that it was formed, started with a handful of people. We stand on the pioneers of other people. That's we don't stand on the pioneers, the shoulders of pioneers. You know what I'm saying? So one of the other advances I've seen in ILADS is it's become more inclusive of other professionals. It used to be much more just MDs, PhD researchers, but I have heard speak this week optometrists, obviously medical doctors, DOs, PhDs. I've heard nurse practitioners speak. I've heard naturopaths speak. I've heard a chiropractor speak. The tent is getting bigger, and I think that is fantastic for patients and for professionals. As a professional, I'm thrilled to learn from different perspectives. You know, I have my lane, and I think that there's a lot of benefit that comes from being a nurse and what we did at the bedside before going on to graduate study and becoming a provider. But I also know that the naturopaths that are here have a whole different training that's really valuable. I know chiropractors look at things from a different angle. Our optometrist showed us some great stuff. We had a couple of people who presented on the dental implications of disease. And I just think the bigger the tent, the better. This needs to be more inclusive. And the more people that we have who understand how these infections impact people, the better it's going to be for early detection and treatment. So, your dentist may not treat your Bartonella or Borrelia or Babesia, but they might find clues that lead them to suggest that you get testing. They showed x-rays. There's a doctor here from Germany, and he has all of his new patients have to come with dental x-rays because he's found these hyperdensities on the roots of the teeth and x-rays that are very common in people who have Lyme borreliosis. So he wants to look at those. And I want to go back and take this to my dentists and people in my community and say, hey, heads up, watch for this. The optometrist gave an excellent presentation teaching not just about how the appearance of the eye can be different with infection, but some of the things he's doing with specific training regimens to help people who suffer from double vision and the vertigo and other things that affect this, like neurologically with disease, because so much of our nervous system is tied to our eyes. So I loved the big tent approach. One of the other things that I really enjoyed, I'm all about biofilms, and I think I've probably mentioned before in the podcast, but biofilms are that matrix slimy armor thing that protects infections and keeps them entrenched. But I was able to learn more about them, and a couple of things I'll throw out to you that are really fascinating, not just in the context of vector-borne infections, but even in things like sinus infections and ear infections. Like, all bacteria prefers biofilms. They live better there. And per the CDC, two-thirds of bacterial infections, this isn't even chronic infections, involve biofilms, but virtually all chronic infections do. So that includes not just your Borrelia, Bartonella, Babesia, Rickettsia, Anaplasma. That means your ear infections, your sinusitis, your urinary tract infections. Certainly, biofilms are a huge part with the chronic infections that plague a lot of cystic fibrosis patients. We've talked about how biofilms are like complex. They're made from a matrix of different materials, fibrin and other things. But what I didn't realize, I knew they were a barrier to treatment, but they found in the lab that you need much, much higher antimicrobial doses to penetrate the biofilms. But listen to the extent of this: 1,000 times more, sometimes even greater. Another speaker said she's seen 10 to 1,000 times more. So obviously, I can't, as a clinician, say, well, usually 100 milligrams twice a day of doxycycline is a good dose, but you've got these biofilms, so I'm going to give you 1,000 milligrams twice a day. We can't do that. We have to find ways to attack these biofilms, and so there was some discussion about different innovative ways that people are researching how we can break those down. We know we can use fibrinolytics. We know there are a lot of supplements and other prescriptions out there that can be part of that. But obviously more research needs to be done. But for me, who sees that in clinical practice a lot, that was really fascinating. Other places they found biofilms were skin, valves of hearts, hips, pics. Another kind of disgusting fact along with that was the amount of infection that they've found in stored tissues and blood. And I couldn't find my slide from this, so forgive me if I'm a little off with my numbers, but they tested donor blood that had been stored for 35 days. And it was like, I think around 30% of the donor blood, they found Bartonella in that blood. It's a little scary when you think about when we get a blood transfusion, which obviously sometimes it's necessary, and there's certain things that are screened for, but there's so much that's not screened for, and that was a little horrifying when you think of that. Another thing that I'm going to throw out to you, there was a really good talk by a naturopath, Dr. Patterson, about the hormonal puzzle and how mitigating and managing hormonal imbalances can help to mitigate the severity of symptoms, especially for patients. And I see this especially with Bartonella, but their symptoms are so much worse either around their period or once they get into perimenopause or menopause. I have some Bartonella patients who are relatively sane for 3 weeks out of the month, but leading up to their period, they're not. Like the level of anxiety or sometimes even psychosis, it's pretty terrifying. So estrogen dominance, having more estrogen than progesterone, there's a proper balance for that. Worsens fibroids, worsens endometriosis, and many critical immune cells have progesterone receptors. So that's another reason why that estrogen dominance pattern needs to be flipped on its head. And one of the ways we do that is just by giving progesterone when it's low. Another thing is that lower testosterone can increase the severity of infection. And I have seen this in patients. They mentioned checking testosterone levels even in young men, and I found multiple young men in their 20s with very low testosterone, so that's really important. But some novel ways to address that, in addition to obviously, I do testosterone replacement if you're 20 and you have the testosterone of a 90-year-old, but vitamin D can increase your testosterone levels by up to 20%. Vitamin D was referenced multiple times for its anti-inflammatory benefits throughout this conference. So, getting some of those really good nutrient labs that we talked about, especially with the intracellular levels, and getting yourself to an optimal vitamin D level, not just a you're not dead vitamin D level, but an optimal vitamin D level. I thought it was also interesting, and I did not know this, that one of the reasons women are diagnosed even less than men is because of how hormones affect our immune response. So for your Western blot, which is that, the CDC hospital lab for Lyme, to get a positive IgG test, you need to have 5 bands. Well, men will frequently show 6 bands, women frequently 4. Because of hormonal differences and how it affects immune system, this test is actually pretty sexist in that a lot of women are just going to be called negative because their immune system hasn't been able to mount an equivocal response. And we know that a lot of labs and a lot of normal labs and lab parameters that have been around for a long time were based on healthy white men, so it's not an equivocal thing, but one of the reasons is because of estrogen, especially estrogen dominance, but hormonal dysregulation. And one book that I ordered while I was sitting in there that I will throw out to you is Dr. Patterson wrote a book called Women in Lyme. So I haven't read it yet, but I encourage you to check it out. It sounded fascinating, and she really knows what she's doing. So, where to wrap up? We don't have a lot of time left, and there is so much great information, but I just want to whet your appetite for some of the fantastic things that I learned. I think the last thing I'll hit on is the microbiome, but also then the interaction of the environment with our gut microbiome. Pollution has caused a loss of microbes and also our quest for, oh, I don't know, we've become almost ultra hygienic in some ways and erased some of that normal bacteria that is important. Dr. Sabine Hazen spoke on the loss of bifidobacteria, and it was fascinating. She does the genome sequencing of the gut microbiome, but severe COVID patients had low bifidobacterium levels. High was protective. low bifidobacteria may be associated with postpartum depression. We know that low levels are associated with invasive cancers, anxiety, and also symptomatic Lyme disease, low bifidobacteria. So, mine's humming during this, going, I got to go check the labels of the probiotics I recommend. But it was actually a different approach that she recommended. First of all, she's done some research that a lot of the products you buy on your supermarket shelf that claim to have pre and probiotic properties don't have what they say they contain. So it's got to be a buyer beware sort of situation. But actually getting that to increase, one of the things you can do is vitamin C, especially in higher doses. Also, bovine immunoglobulin. So, bovine being cow immunoglobulin, part of the immune system, that's been shown to increase bifidobacteria, also decreasing some harmful bacteria. It's helpful with inflammatory bowel disease. So, a lot of exciting developments. And in addition to our environment wreaking havoc on our microbiome, it affects genetic expression. So that genetic expression or epigenetics is what causes disease persistence. That's why we talked about you can have 100 different people who are exposed to Borrelia or Bartonella or COVID or mycoplasma or any number of infectious things. Some people do not get sick or have very few symptoms, and some people get very sick, and some people just don't get better. The way Dr. Boswell explained it, which was interesting, is sometimes regions of your gene. So, DNA has that ladder that's kind of twirled, a DNA double helix. So sometimes those gene regions will uncoil, they'll come apart in places, and it makes them more vulnerable to attack. And one of the reasons that people have had a lot of issues post COVID, it's not because the virus is still there. It's not. It's because of what it did to the immune system, and particularly people who were genetically vulnerable. But there are things we can do to repair. I will throw in one more thing about COVID because it was really fascinating. Dr. Bruce Patterson does a lot of research with long COVID, and he talks about how acute COVID causes like profound immunosuppression. And what I've said from the beginning with a lot of my patients, COVID suppressed their immune system. And so other infections that had been there, been kind of under control, were able to flare. And he advocated to, instead of having it called long COVID, have it called PASC, which is post sequelae of COVID. But one fascinating study in his long COVID patients, he does a lot of research with like AI learning and a lot of these computer algorithms that are able to analyze data in some really fascinating ways. But the vast majority of patients with long COVID had Epstein-Barr, human herpes virus 6, or both. A third of them had HHV6 and Epstein-Barr, and those people were the most vulnerable to some of these symptoms. So one, if there could be a silver lining to COVID, because it really disrupted a lot of things, it's kind of forced the medical world and public health officials to acknowledge that an acute affection can have long-term consequences, which is something a lot of people in the world of vector-borne infections have been postulating for a long time. We have a lot of really direct evidence of that. Most importantly, our patients' lives. But COVID and its aftermath and the unfortunate sequelae or consequences in some people's lives of this long COVID picture has opened some eyes to what infection can do. And some of the treatments that they're coming up for that condition can be helpful in chronic Borrelia or Bartonella, because what happens even after the infection has been cleared, your body has to take out the trash. And I always think it's telling if multiple speakers have one concept that's repeated. And we had researchers, naturopaths all bring up this concept of you can do all these things to treat, But then you've got all this garbage that has to be cleared, all this inflammatory cascade, these cytokines, just all of the garbage that needs cleared. And that's part of the healing process is reducing inflammation, boosting the immune system, helping clear the damage so that you can rebuild to a healthier you. Luckily for you, I was able to connect with a lot of people at ILADS that are willing to be guests on Made to Be Whole. So look forward in 2025 to hearing more from some of these amazing individuals. Have hope and remember you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.